Hello and welcome to this CNBC-TV18 special, and today we are joined by Pharma Secretary Arunish Chawla. Recently, this department came out with a very detailed and much awaited code on pharma marketing practices. A very warm welcome to our show, sir. How the government is ensuring that this code is adhered to?
The Uniform Marketing Code for Pharmaceutical Companies 2024 was notified 1 month ago. The pharma associations are the first point of stop for implementing the code. And this is based on what is called a model of cooperative compliance, as most ethical codes are. The pharma associations essentially include the Indian Pharmaceutical Alliance, which is the association of the biggest 25 pharma companies which are Indian. The OPPI, which is a similar association for multinational pharma companies which are operating in India. The third big association is the IDMA, the Indian Drugs Manufacturers Association, which is a large association of 1,100 medium, small drug manufacturers all over the country. And the fourth is the Bulk Drug Manufacturers Association, which is an agglomeration of about 300 bulk drug manufacturers in the country. Put together, they account for about 1,300 to 1,400 pharmaceutical companies operating in India. Parallelly, we have collected market data from the market footprints of companies over the last 3 to 4 years. We've made a list of 1,300 pharma companies which are marketing their drugs and their products in the Indian market. Today's meeting was called at the end of the financial close, which is on 1st April. And going forward, as you know, all the companies have to give their undertakings over the next 2 months. We are preparing a panel of auditors. The previous code that you mentioned was voluntary. It was a pilot experiment. It led to learning. You know, when you bring in an ethical code of conduct, an entire industrial culture has to change. It has to evolve. That takes time. And this is a very dynamic process. The industry is undergoing a very fast transformation. The new code is mandatory. It is not voluntary. Why it is mandatory is because there is a government oversight. There is a risk-based audit. There is a self-certification, and there is a redressal mechanism. In addition to that, some people will ask whether it is statutory and non-statutory. The answer to that question is this is quasi-statutory.
If the code is not adhered to, what is the penal action?
Section 12 of the code has 5 different subparagraphs. When we write a code, we look at the target audience. The code is written in a simple language so that a medical representative, an ordinary health practitioner can very easily understand in simple English what they can do, what they cannot do. Those who are implementing the code and government agencies read the same thing differently. If you go through the code carefully, it mentions certain statutes very clearly and explicitly. It mentions the advertising practices. It mentions the Income Tax Act. It mentions the MCI regulations, loud and clear. What is, if you ask me, this is game theoretic, but I'll put it in very simple words. A reputational play is the best defense against unethical market practices. And that is what the codes try to achieve.
If a particular company does not adhere to the code and is found flouting the norms, This department is going to publicize it in public through social media and various other platforms. Is that what you're hinting at?
Loud and clear, and we will not stop at that.
So name and shame is the idea of the penal action over here?
Name and shame is where it begins. The story will go further. We will wait till the end of May for every company to submit their undertaking. We've already made a list of 1,300 companies. We have picked up a panel of auditors from the CAG empaneled auditors. Those who do not give undertaking will automatically go on a risk-based audit framework. When there are violations of different code statutes, some mentioned herein and some not mentioned herein, the Department of Pharmaceuticals will bring in those government agencies and those authorities, including those statutes and laws which are relevant to that context.
Pricing of drugs has been very crucial. It impacts everyone, not just in India, but globally. Drugs and medical devices have to be made available 24/7 at an affordable price. So what is this committee all about? What is going to be the entire idea of the government with this new committee under your chairmanship? Just your comments on that.
The old pricing framework was evolved in 2012 and 13. It is now 10 years old. Any new legal framework that is evolved has to be given time to, come to its own. And while that is done, the industry evolves and the industry changes structurally. In the last 8-10 years, the drugs and medical device industry have undergone a huge change. The older code, the older control order, was essentially designed for drugs alone. It was not designed for medical devices.
Yes.
Medical devices is a sunrise industry in India. It is now growing year on year at a double-digit rate. For ordered growth of that industry, and it is imperative that the control orders and the pricing framework recognizes the structural differences between drugs and medical devices. There were demands from the industry that a lot has changed in the last 10 years, and therefore, in light of new realities and in light of a fast growth of a star industry, which is now called the pharmacy of the world, we need to look at the framework and modernize it with time. That is why this committee was constituted. The committee has started its deliberations. All stakeholders, all associations, including the healthcare customers and the users, health providers, they will be consulted, and on the basis of that, we'll go forward. I'm afraid I will not be able to divulge more details.
Whether the drugs and medical devices will be made more affordable in the country or not with this new pricing mechanism, your word on that.
You have to read the terms of reference carefully. The terms of reference mention that there will be an availability, affordability framework for critical drugs and essential drugs. There will be a price moderation framework for medical devices that makes medical devices affordable while at the same time providing incentives for industry to grow. It will look at new drug therapies, high cost, high margin treatments, which are the treatments of the future, which are coming into the market. It will also reorganize the National Pharmaceutical Authority to cater to the demands of a fast-changing industry.
Pharma has been one of the most attractive areas across the 14 sectors of PLI which were announced by the government. Your views, your comments, how has been the offtake so far?
We should celebrate the moment. Pharma PLIs have been a resounding success. 3 PLIs schemes have been rolled out in the sector, covering pharmaceuticals, bulk drugs, and medical devices. The pharmaceutical scheme has exceeded all expectations. Already 25,000 crore plus of investment has come in, and production targets have been exceeded. Exports have ballooned. And in the closing year, the Indian pharma industry exported more than 50% of its output. Now, that is a big landmark. The bulk drugs and medical devices are difficult schemes, and they have succeeded. Greenfield plants have come up in India, and 50 of them were inaugurated last month in a nationwide, widely televised inauguration ceremony. And that happened. With that happening, a lot of energy came in, and 50 greenfield plants actually started working and started producing bulk drugs and medical devices, which hitherto were entirely imported in the country. Last but not the least, it is very important to look at independent data. In the meditech sector, in the medical devices, for the first time, the imports came down in absolute terms. For the first time ever. And exports are growing double digit. That is the best independent evidence that PLI schemes have been a resounding success.
My last question to you, your word to manufacturers, to the pharma industry, to vaccine manufacturers, and to doctors especially, that what should be the future of this particular industry in India? What is the vision for next 5 years?
Take off is the word. India has arrived, and India pharma and meditech industry will be the star of the future, and you will see India shining on the global stage.